Did you know about this? Cystic fibrosis. It's a condition you've probably heard of, but how much do you really know about it? In this video, we're going to dive deep into 5 crucial facts about cystic fibrosis that might surprise you. We'll break down the science in a way that's easy to understand, explore the impact this condition has on people's lives, and most importantly, arm you with the knowledge to make informed decisions about your health and the health of your loved ones. All right, let's start with the basics. Cystic fibrosis is a genetic disorder. What does that mean exactly? It means that it's passed down from parents to their children through genes. You know, those tiny blueprints that determine our traits. Now, there's a specific gene called the CFTR gene, and this gene is responsible for making a protein that regulates the movement of salt and water in and out of our cells. With cystic fibrosis, this CFTR gene has a mutation, a kind of glitch in the code. Because of this glitch, the protein doesn't work properly, and that's when the problems start. Think of it like a traffic jam inside your cells. The faulty protein creates a backup, leading to a buildup of thick, sticky mucus in various organs, especially the lungs and digestive system. So, we know that cystic fibrosis affects how salt and water move in and out of cells, but how does that actually affect the body? Well, the thick mucus we talked about, it wreaks havoc on the respiratory and digestive systems. In the lungs, this mucus clogs the airways, making it difficult to breathe. It's like trying to breathe through a straw that's constantly getting clogged. This can lead to persistent coughing, wheezing, and frequent lung infections, which can seriously damage the lungs over time, and it doesn't stop there. In the digestive system, the mucus can block ducts in the pancreas. The pancreas is crucial because it produces enzymes that help us digest food and absorb nutrients. When these ducts are blocked, the enzymes can't reach the intestines, leading to problems with digestion and nutrient absorption. Now, for the question you're all probably wondering, is there a cure for cystic fibrosis? The truth is, right now, there is no cure. But hold on, that doesn't mean there's no hope. In fact, there have been incredible advancements in treatments that are dramatically improving the lives of people with cystic fibrosis. These treatments focus on managing the symptoms and slowing down the progression of the disease. For example, there are medications that help thin the mucus, making it easier to clear from the airways. There are also therapies to improve digestion, like taking enzyme supplements to replace the ones the pancreas isn't producing effectively. And of course, maintaining good lung health is crucial. This includes airway clearance techniques, which help loosen and remove mucus from the lungs, as well as regular exercise to keep those lungs strong. Now here's a crucial point. Early diagnosis of cystic fibrosis can make a world of difference in a person's quality of life. That's why newborn screening is so important. In many countries, newborns are routinely screened for cystic fibrosis shortly after birth. This simple blood test can detect the disease early on, even before symptoms appear. Early diagnosis allows for timely intervention, which means starting treatments and therapies sooner rather than later. This can significantly slow down lung damage, improve digestion, and ultimately lead to a longer and healthier life. Here's another important fact. Cystic fibrosis is more common in certain ethnic groups. In the United States, for example, it's most common among Caucasians of Northern European descent. Why is this? Well, it has to do with genetics and the history of populations. Certain genetic mutations, like the one that causes cystic fibrosis, can become more common in specific populations over time due to various factors, including migration patterns and historical events. It's important to understand these disparities in prevalence so we can ensure that everyone who needs it has access to testing, treatment, and support. Now let's talk prevention. While we can't change our genes, there's a powerful tool that can help prospective parents understand their risk of having a child with cystic fibrosis: genetic counseling and testing. Genetic counseling involves meeting with a trained healthcare professional who can assess your family history, discuss your risk factors, and recommend appropriate genetic tests. If both parents are carriers of the CFTR gene mutation, there's a 25% chance with each pregnancy that their child will have cystic fibrosis. Genetic testing can provide this crucial information, empowering couples to make informed decisions about family planning. They may consider options like in vitro fertilization with pre-implantation genetic diagnosis (PGD) to select embryos without the CFTR mutation. So there you have it. We've covered 5 important facts about cystic fibrosis. We've learned about its genetic basis, its impact on the body, the importance of early diagnosis and treatment, and the role of genetic counseling and prevention. Remember, while cystic fibrosis is a serious condition, advancements in medicine and increased awareness are making a real difference in the lives of those affected. You have the facts and the strategies to prevent cystic fibrosis. Stay safe and stay healthy. Don't forget to like, subscribe, and share the message. Comment if this information was helpful. Prevention is power.